physiotherapy is very helpful, but I kind of felt like that there was a missing link, something that is kind of missing from my therapeutic tools. So as a physiotherapist, I was kind of looking for something which is more holistic, which has a more holistic approach, until the point, because I'm kind of curious person, and I'm always looking for and searching for something additional that I can just add to my job, that when I started using the manual therapy tools, I felt like I am kind of good at my job, and I always got a feedback that I could help in very difficult and complex cases. The patients were really grateful for the job that I did, until the point I met some clients who were even more complex than I met before. So complex means that they didn't just have like a simple symptom. They also had like a complex systematic problem, which meant that in the therapy, we were working together with manual therapy techniques, we were working together with some exercises, but after some sessions, we kind of hit a certain point where we couldn't go further with the therapy. And however, I was able to help a lot to those clients, but I kind of felt like, okay, there's still something missing. And these clients kind of just showed me that it would be really important when we work to have an additional knowledge, not just about human anatomy, not just about the joints and ligaments and the tissues and the fascia, but also how our body is kind of connected to what actually happens to us, how my life, how the environment, how the stress, the trauma that I might happen to experience has an effect on the human body. And this is what I eventually discovered during as a manual therapist, that for many clients, it is really helpful to work with the body. But in some cases, in some more complex cases, actually the body involves more from our story. And we meet a client on the treatment table, not just by their symptoms, but we meet them with their whole story, with their whole life. And that has a huge effect on the body itself.